We are back 7:39 this morning on the race for a vaccine. We are rolling up our sleeves and we're going to tackle your questions.
That's right. Emergency approval of Pfizer's vaccine could come as early as tomorrow. And according to a recent poll, once that happens, 61% of Americans say they're ready. They're willing to get inoculated.
All right. But we know that a lot of people have a lot of questions and concerns. So we brought in our experts, Dr. John Torres, Vicky Nguyen, to answer the top questions on Google. Guys, good morning. Dr. Torres, why don't we start with you? One of the most Googled questions is this, and it's a basic one. Is the COVID vaccine safe?
You know, I think this is the big question, not just for everybody around the country, but for the FDA as well. Dr. Steve Hahn, the commissioner of the FDA, personally told me that they would not authorize this vaccine unless it was found to be safe and effective. So far, by all the data we have, the trials have shown it to have a really good safety profile. We know there might be some minor side effects, but overall, seems to be a very safe vaccine.
That was the next top Google question. What about side effects?
So the side effects have been minor. They had no significant side effects, but the ones they did see are ones that are typical with most vaccines. Injection site soreness or redness in the arm, or maybe a little lump where you get the shot, fatigue, headaches. Those were the ones that the majority of people had. Some people complained of muscle aches, but everyone said it eventually went away in about a day and a half. And so it was one of those ones that went through very, very quickly.
All right, let's go on to Vicky Nguyen. Vicky, another one of the top questions is this. A lot of people are desperate to get the vaccine. It hasn't been approved yet, but the question is, when can I get it?
As early as next week, if you're one of the 24 million Americans who is a healthcare worker, elderly, or in a nursing home or caretaking for someone. Then the second phase, which is expected but has not been confirmed yet, is essential workers. Think transit workers, teachers, police, first responders, people who work in food manufacturing facilities. That has not been clear when, but that is expected to be the second wave. And then finally, for Americans who are not priority groups, that's probably going to be late spring or early summer.
Can I ask a follow-up? Just because Savannah and I were talking about our moms, and a lot of people have moms in that age category. Like, how will someone tell them you can go get the vaccine now? How will they know?
Well, you were mentioning that in some cases, hospitals and the pharmacies are actually texting people, giving them, advance notice. We're doing what we can. Talk to your primary care provider. Ask, am I in that first group? How do I get my hands on this vaccine?
And can an employer require folks to get vaccines, its employees?
Savannah, the answer is likely yes, because they could consider this a health and safety requirement. Think about it. If you are a healthcare worker, you work in a hospital, you're already required to get the flu vaccine. So the COVID vaccine is expected to be the same. Now, there are some exceptions. If you're part of a union, your union may negotiate out of that requirement. Perhaps you have a sincerely held religious belief against vaccines. That's another way to opt out. And under the Americans with Disabilities Act, you may be able to ask your employer for an exception if you work from home.
Let's go to Dr. John. We have a good question. How long will the vaccine last? It's going to be like the flu shot where you got to go every year?
At this point, we don't know, and we won't know until time passes and we can actually see how long it's lasting in people. But by all indications, we expect it to last a few years, hopefully even longer. And the main reason is because the virus itself is not mutating significantly, so it's not changing, and it seems to be very vulnerable to the vaccine. And so talking to Pfizer, they actually share with me that they think that this one will last years to come. We just don't know how many years that's going to be.
And Dr. John, millions and millions of people have had COVID and survived, and they may even have antibodies. Do those people need to also get a vaccine, or are they already covered?
No, they do need to get a vaccine, and the main reason is because we don't know how long that natural immunity will last or how many antibodies you might have from having had COVID and recovering from it. But we do know that when you get the vaccine, you get a baseline of coverage, you get a baseline of protection, and it's a vaccine that can be very, very effective, even if you've had COVID-19 in the past.
So you can't overdo it. You can't have too much in your system.
No, you can't have too many antibodies. And if you think about people getting convalescent plasma or monoclonal antibodies on top of having COVID and their immune system fighting it off, the immune system doesn't work that way. It gives you enough to fight off the virus and then goes back into retreat. But it's not one of those things that you can overload in antibodies.
Okay. And then the other Google question we had, Vicky, where will I be able to get the vaccine?
So state health departments are still working out these details. Expect it at your major pharmacies, the Walgreens, the CVS's, and hospitals and vaccine clinics as well. Some states, like Louisiana, Louisiana, we talked to the pharmacy director there for the largest hospital system. They've been working on drive-through flu clinics, so they'll be ready for vaccinating major numbers of people.
And it's free, right? You get it for free?
The government says it will be free. There may be a fee associated with administering the vaccine, but most insurance is expected to cover that fee. But whether or not you're insured, you should be able to get the vaccine for free, according to the CDC.
It's just a massive undertaking when you're talking about inoculated hundreds of millions of Americans, to say nothing of the whole world. I mean, it's just pretty incredible. Vicky, Dr. Torres will be talking to you lots about this. Thank you.
Thank you.